We are live here at Breast Care of Western New York, just outside the village of Williamsville, as we begin our two-day push to get 550 women to schedule their mammogram. It is part of our 6th annual Mammathon. In the last half hour, we talked about the very basics of mammograms. Joining us this half hour, Dr. Mariola Poss again, to get a little bit more into detail about why mammograms are important. Doctor, thank you for joining us this morning.
Thank you.
And so explain to us, if you could, in a little bit greater detail, why a mammogram is so important, especially yearly for women over 40.
Well, we know that mammograms save lives, in essence, and we know that if you get your mammogram every year, that will find cancers early, and that we know saves women's lives and allows us to be able to do less treatment down the line.
When you talk about treatment, if you detect something in a mammogram, how does that sort of guide the path of treatment from your end?
Well, it tells us, I'm a surgeon, so it tells us what kind of surgery is most important. And based on that, it also helps guide what type of therapy would be indicated first. Sometimes we do medical therapy first and sometimes surgery first. So it really helps guide all that decision making.
And especially over the course of the last couple of years even, we're learning about how treatment is different for everyone. Years ago, it seemed like radiation was obviously the way to go. Now there's just so many other options out there.
We're able to do less treatment for a lot of people, and that's because of all the innovations we've had in medical therapy. So some women won't even need lymph nodes removed, which we used to do routinely for everyone. So it's really been great advances recently.
We are in the Breast Care of Western New York. We're just right outside the village of Williamsville, one of 2 locations where people can get their mammograms. How do the teams work together between here and the location in downtown Buffalo?
Well, we work very closely. We have the same radiologists who work here in downtown, and we're in constant communication with them regarding the findings so that we're able to provide the best care for our patients.
Who should get a mammogram?
Any woman starting at age 40 for average risk. And then some women, obviously, who have other risk factors need to even start sooner. So it's really important to talk to your doctor about that.
Absolutely, especially these conversations should begin right around the age of 25. Is that right?
Correct. And it's good to just talk to your doctor, go over family history, other risk factors, and obviously if you have any concerns in terms of what's going on with your breast health, then talk to your doctor and they can advise you.
Dr. Poss, thank you so much for joining us this morning. October, obviously Breast Cancer Awareness Month, so we are really driving the point home to schedule your yearly mammogram, especially if you're over the age of 40. There's a QR code right now on your screen. You can scan that to schedule that critical appointment. Scott will send it back to you.